I'm Stephanie. This is Brian. We're going to be teaching you how to access a power port today. So I've already established for this patient, they have a power port. I can feel the 3 dots underneath their skin. For a lot of patients, you'll also be able to see the 3 dots. The other, you need 2 methods of verification. The other can be an x-ray verification, or they may have a power port card or a power port band. So once I have 2 of those 4 verifications of power port, I would grab my power port needle. Comes in this pack. It's already been dropped in our sterile tray for us. So then we also have a mask. So if the patient and I both weren't masked, we make sure that we both have a mask on. And then I also use a lock, so like an IV extension tubing, and that is what I use, so that way you have a little bit extra tubing to work with. I'm going to grab my sterile gloves out and go ahead and get set up. So since we do not have sterile flushes at Midtown, oh Lord have mercy. Okay. I'll put my sterile gloves on. These ones in the kit definitely do not fit everybody. And then I will have my lock, either a hub or a lock, and my power port needle that I've put sterilely in this tray. I'm going to hook them up so that I have this extension tubing on it. And then I'm just going to hold this so I can be primed, and Brian's going to go ahead and flush that for me. Try to keep that as still as I can. And he will just flush until I see perfect, and then you can unscrew that for me. Perfect. So my line is primed and I'm good. And then I like to use this as like a sterile, area to work with. So I'm going to unfold it down here, so I have plenty of room to work with. Then I have in here alcohol swabs, 3 of these. So to start cleaning, I've already identified where the power port is. I'm going to start in the middle of the power port. I'm going to be working concentrically, working my way out, trying to make sure that I get any materials off of that power port. So scrubbing concentrically, making a bigger circle, working out. I'm never going back in towards the port once I've worked my way out. So again, start in the middle, bigger circle each time, working my way out. So I've established where the port is. I have my stuff set up. I've cleaned with alcohol. I'm going to let that dry. And then next what I'm going to do is I'm going to be cleaning with chlorhexidine. This is the important part. So this is where you have to click. You hear that liquid release. Then you're going to go over the port, and you're actually using a basket weaving motion. So this is going to mechanically clean with the scrubber and chemically clean. So I'm going to go over the port. I'm right on top of that port, and I'm using basket weaving motions, going back and forth on that port. And then I'm going to work my way on the outside of the perimeter where that dressing will be. So I'm not circling back to where I was cleaning over the port. I'm just also making sure that I have a clean, sterile field around the port. Okay, so chlorhexidine needs to dry for at least 30 seconds. So in the meantime, I'll get the rest of my stuff set up while that's drying. Our little mannequin doesn't have real skin, so he's not going to look dry, but your patient's skin should look dry. This is the bio patch. If this doesn't come in your kit, you may have to grab this additionally and drop it in, just like your Hubert needle and your extension. So I'm going to open this guy up, have it ready for me for once I access it. I also have the skin protectant I'll use afterwards, and their dressing. So I grabbed a power port needle because I have verification, the 1-inch. Depending on your campus, you might have varying sizes and gauges, and then there's also the standard Hubert needle that you can use. The only difference would be you wouldn't be able to access and give CT contrast through a non-power port needle. So I know that my power port's right here. This is dried for 30 seconds. I'm feeling on my power port. I have those 3 dots that I can feel in the middle of. Once I know that it's established, I'm holding the port still with my non-dominant hand, And I'm accessing the port directly straight down, 90-degree angle, till I meet resistance. So I can feel that that's in. Again, I don't have sterile flushes, so I'm not going to be able to flush that while it's in. So we're gonna get it safe first for the patient. I'm gonna grab that bio patch, putting it the word side up. They make this easy. It literally says this side up for you. Really straightforward. There we go. I'm gonna slide this around the Hubert needle. I've seen other people have this on the needle when they go to stick. I just would be scared to drop it and it roll off my field, so I just put it on afterwards. Then in this pack, I have the skin protectant. I'm gonna take the skin protectant swab and swab around where this dressing's going to touch, making sure that skin's not gonna get irritated with that brutal Tegaderm. On normal skin, that would dry pretty quickly. This is our dressing. I definitely think this is the most frustrating part of accessing a port, is that it's not quite the biggest Tegaderm or a size that all of us would like. However, the easiest way to make it work is lining the slit up over where your line comes out. So I'll line this slit up over and this window over my port and put it down, and then I kind of press around, making sure that I'm adhering all the sides down. So I'm going to pull on this tab. Again, this guy's skin is tape, so he's not sticking very well to a Tegaderm. I'm gonna pull and adhere down to their skin. Pull, adhere down, pull, adhere down. Continuing to work my way around the dressing so that it's nice and secure against their skin. I would then chart the size, gauge of the port, and I would initial with my name, date, and time that I accessed it, so they'll know when to do a dressing change upstairs. If I were to be de-accessing a port before they go home, I have to make sure the doctor puts in an order. There's a separate order for a HEP lock. Looks like this. So heparin lock. So you would go and grab your HEP lock once it's ordered and make sure you're flushing the port prior to de-accessing the port. If I were pulling blood from this port, I'm always going to want to pull at least 10 waste for the central line. So I'm going to waste off 10 mLs, and then I would be able to draw. So, and you want to also make sure you're flushing with the 10 mLs again after you've pulled off blood. And that is it, and how to access a port.